G'day. Today's training module is on cardiovascular training, or sometimes called aerobic training. The definition of cardiovascular fitness is the ability of the heart, blood cells and lungs to supply oxygen-rich blood to the working muscle tissues, and the ability of the muscles to use oxygen to produce energy for movement. In preparation for cardiovascular exercise, ideally you should be warming up for at least a couple of minutes, ideally aerobic type activity. And if necessary, stretching is required. So if you have an issue with a part of your body that needs greater preparation, then stretching for that area can be helpful. The duration of the warm-up will be dependent upon the intensity of the work to be performed. For example, if the client is doing a sprint or plyometric type session, the warm-up should be extended. Different training phases of cardiovascular exercise include, firstly, long, slow distance. So long, slow distance, as it says, is a long, continuous type exercise and should be for at least 20 minutes. So you want to be in the training heart rate zone for 20 plus minutes. This will allow you cardiovascular benefits. This excludes a warm-up, so the time it takes you to get into the training heart rate zone and prepare for your workout is not included in the 20 minutes. The intensity of that workout will be dependent upon the client's level of fitness, but it should be an intensity that they can maintain for the period of time selected, whether it be 20, 25, 30 minutes, etc. The next type of training phase is fartlek. And fartlek training involves training at varying intensities over a continuous period. This may involve changing elevation or resistance or changing speed. For example, alternating the elevation and speed on a treadmill. As with long, slow distance training, fartlek training sessions should be for at least 20 minutes in the training heart rate zone. Next, we have interval training, and interval training can be broken down into either aerobic or anaerobic intervals. Firstly, looking at aerobic interval training. The purpose of interval training in an aerobic capacity or nature is to develop the aerobic system and should include periods of work of a minimum of 3 minutes at a maximum intensity for that period of time. That intensity should be at anaerobic threshold. The rest period between the intervals should be similar to the duration of the work period. So if you're doing a 3-minute work interval, you should have approximately a 3-minute rest interval. Ideally, you would do between 3 and 5 intervals. Then we have anaerobic interval training. This type of interval training is to develop the anaerobic system and should include periods of work of anywhere from 30 seconds to 2.5 minutes at maximal intensity. The rest period between intervals will be dependent upon whether the purpose is to develop lactate tolerance, in which case a shorter rest period, for example 30 seconds, would be suitable, or if the purpose is for lactate threshold training, then ideally you want to be having around 3 minutes rest. And finally, we have sprints. Sprint work may be performed to increase the efficiency of the anaerobic system, especially or specifically the adenosine triphosphate phosphocreatine system, or ATP-PC. Sprints should be for a maximum of 30 seconds with a work-to-rest ratio of 1:4. That is, the rest period should be 4 times longer than the work period. Sprint work is also an effective way of maintaining cardiovascular fitness without inhibiting the gains from strength training. Looking at the training heart rate zone, it is difficult to establish a client's training heart rate zone accurately without establishing their maximal heart rate. At Personal Best, however, we unfortunately do not have a suitable environment with which to conduct such a test. Therefore, the most effective means of establishing a client's training heart rate zone is to use rate of perceived exertion or a submaximal test. This can be used in conjunction, or these can be used in conjunction with establishing how long a client can maintain a particular level of exertion. That is, how long in each of the different training phases. Monitoring how a client sounds and looks at a particular level of exertion can also provide valuable information in assessing a client's RPE, or rate of perceived exertion. There is an element of trial and error in establishing a training heart rate zone, and you should err on the conservative side during this process, especially with untrained clients. Note that the 220 less age formula is quite inaccurate. A client may have a maximal heart rate of 30 beats higher or lower than the norm for their age. Therefore, the result you would get from such a formula can be quite inaccurate. So, as previously suggested, it's best to use either the rate of perceived exertion or a submaximal test to ascertain the ideal training heart rate zone. To give you an idea of the rate of perceived exertion, then as you can see there, a level 5 would be moderate, moving to a level 7 being hard, and level 9 being extremely hard. So for long, slow distance, ideally you want to be around that 6 to 7 mark on the rate of perceived exertion. If you're in an aerobic interval type training, then that would be 7 to 8, anaerobic would be 8 to 9, and sprints would be 9 to 10. It's important after you finish the exercise to decrease the intensity of the cardiovascular activity for a minimum of 2 minutes at the conclusion of the cardiovascular training in order to assist with venous return. Now, if you have any other questions on prescription for your clients with regard to cardiovascular activity, make sure you send an email and ask for clarification in any area. I hope you've gained some value from this webinar. Have a great day.